Alright, everybody, so welcome back to Tomboy Official. We're still talking about gender dysphoria. We're somewhat speaking about it still. And, we've gone through a lot of definitions. We've gone through a lot of information about, just in general what interventions look like and the process of, some difficulties coming up with interventions lately and support and things like that. So, there are some kind of resources that I would say are somewhat helpful for people, and I'm going to talk about those, and then I'm also going to talk about what is it called, I mentioned before ISTDP. That's a type of therapeutic intervention. ISTDP stands for intensive short-term dynamic psychotherapy, looking at sorry, the neighbors are testing cars. Looking at defense mechanisms and how they come up and kind of make it so that a person isn't really able to fully accurately work on their own processing of emotions and difficult kind of situations that come up that are distressing, and how people kind of end up falling into the same patterns. ISTDP can be very helpful for that, in kind of identifying defenses that come up and helping a person be able to recognize what's happening, recognize the patterns leading to the defenses, and then working on the defenses as well as the patterns, as well as different distress experiences, if that's mental, like in the mind, negative thoughts, negative kind of internal dialogues that can be negative, a lot of thinking that can be negative, as well as emotions that can be negative, and different types of feelings that people don't maybe want to experience. So I wanted to talk a bit about kind of what that looks like, and in general, I would say, when someone needs a type of support, I'm not sure if these support sources work outside of the US, but I would say one helpful support app for people is called 7 Cups. So I don't think I have the app on me actually, but I'm scrolling looking. 7 Cups is basically an app that is a peer support app. And so the people that are helping the ones who are logging in to get assistance, it's like a peer run site. So these people might not be actual licensed clinicians or professionals or doctors. But they're there to support people. So a person who wants support, they can usually find different areas where they can ask for support. So there's a section for LGBTQ. There's a section for social anxiety. There's a section for depression. There's a section for trauma. There are all these different types of sections where a person can say, there's a bot that basically checks and says, we're waiting for the next available person to help you. What's the issue that's coming up for you? And you can type in whatever it is, gender dysphoria or anxiety or something like that. And then whoever's next available will be assigned. You can filter age ranges, genders, different backgrounds of the person that's going to help you. And you can also pick based on category. And there's also another option where you can go in and scroll and search through the available people, and you can look to pick one of them. I would say, from testing this app, I would say it's a good app. But if you're really, really needing a lot of support right away, it's not always going to be like 100% on point. So sometimes, when I've tested it and using like, questions like, okay, LGBT concerns or like relationship issues or something like that, a lot of times they might not have the LGBT support person or someone who understands that. So that can be difficult, but some of them seem to be pretty open-minded, at least for the majority, willing to listen, willing to understand, just trying to get like a better understanding of the situation that's happening and going on, versus and trying to help you, versus being judgmental or being like, sorry, I can't help you because I'm not gay or something like that. So that might come up, or there might be people who can help talk about anxiety, and just someone that'll listen on the other end. And this is texting, a lot of it's typing, texting. As far as I know, I didn't see audio on there. And then there is an actual feature to buy it, to purchase, I think, 4 weeks of paid therapy. I would say this app is better to use for free. That's my own personal opinion. If you want to pay for the therapist on an app, I feel like the ones through BetterHelp might be a better option. Just because the 7 Cups app is a little bit like sometimes it'll lose your messages. So you're not like, so if you send a message to a therapist, it'll get through. But if you don't, like, say if you wanted to save the whole conversation to come back to it like at a later time, sometimes it only saves like small bits of the conversation, and you've already paid for all that. So you can't go back and like look it up. And I know this is on the app, so it might be different if it's on the desktop, but I would say that's kind of a downside in my own personal opinion. Another thing is that it's really overpriced. I want to say it's over $100 for 1 week. I think BetterHelp is as well, but I just feel like the BetterHelp app is a little better than the actual paid therapy on 7 Cups. So for BetterHelp, I think you can get like a free trial. I could be wrong. But for 7 Cups, there's the free section where you don't have to pay for therapy at all. And they also have the groups. And then they also have kind of like little goals for the day of like whatever you're working on, like, or positive thinking, little quotes and affirmations and stuff, mindfulness little sections. And this is a completely free app unless you decide to pay for the therapy. Now, I'm not going to say that the therapy on there isn't good. I would just say that the app is a little glitchy, but it's not that bad, honestly. If you had only ever used 7 Cups, I would say it's better priced than some of the other online therapies, and it's kind of more casual to use, and I do really like that it has that free feature. There's also BetterHelp. So BetterHelp is licensed clinicians that are on there, and you pay for therapy per week or month or so. And so I would say the comparison between those therapists would be, the therapists seem to be equally, capable to support and help with situations. One thing that I don't like about online therapies, and in general, is something that I work in therapy, so I kind of understand this, but I kind of don't like the aspect of people providing worksheets to you when they haven't developed rapport. There was somebody I came across that was let me see. They were just like, fill out this whole, it was like an assessment almost about yourself. And then after you fill that out, it was like, okay, now here's a worksheet to work on. This is the main problem. Here's the worksheet. And it's like they weren't even really kind of talking. They were just like, here's a worksheet, fill it out. Oh, I see you picked number 7 and number 2. Here's another worksheet for that. And then like, and it's kind of like you're kind of just doing it yourself, and this person, you already paid them. And so it's kind of like, to me, it was kind of just like, this is what I paid for. Like, I could have just Googled this. These, just tell me the worksheets, I'll Google them myself, like that kind of thing. Like, I was kind of just like, it was kind of off-putting. And you can talk to the therapist if you don't want to if you don't want to see them anymore. I believe BetterHelp has the option to switch therapists if you're not interested. I think they do. BetterHelp does have a video option, a text option, and I think like a call option. 7 Cups, I'd have to double check if it has that. Let me see if I can log back into it and see what it has. But I would say online therapies are becoming a very useful thing for people. Let me see. Oh boy. This is taking a long time. Let's see. I don't think I have a login. I don't know what it is for 7 Cups. And I'm not gonna spend this time to look for it, but let's see. Yeah, I would say you'd want to check and see if the therapy option has the option of chat, video, and audio, like voice chat, type chat, or videos. I know BetterHelp does. And then for people who aren't interested in either, there's also 2 free online support services. So one of them is, you text START to 678. So text the word START to the let me see. You text START to, I gotta look this up, guys. Sorry, I'm forgetting it. It was on the top of my head. So it's the Trevor line. And that's 678. Oh, that's what it is. Okay, sorry. I was right, but it just didn't seem right. Only 3 numbers. So you text START to 678-678. And it's the Trevor Project. So this one is geared towards connecting to a short-term support counselor, like instantaneously almost, or within the next available time for a support person to be available. It says Trevor Space. This is an additional resource. Trevor Space is an online international peer-to-peer community for LGBTQ young people, excuse me, and their friends. And then it says Trevor Support Center, where LGBTQ youth and allies can find answers to frequently asked questions and explore resources related to sexual orientation, gender identity, and more. And so, sorry, I need some water, man. So, these are just things that you notice. So you can text START to 678-678. You can call the phone number 1-866-488-7386. Again, the number is 1-866-488-7386. And then the website itself is thetrevorproject.org. TheTrevorProject.org. So thetrevorproject.org. And At the top of that site, it has the phone number. It has a button that you can tap to text. It has a button that you can tap to chat on the app itself, or the website itself. And you can sign up to get on their email list, or you can become a volunteer through them. So these are all options as well. And this is mostly for people. I'm trying to find the age ranges here. I know this one has an age range. I want to say it's to age 24 or something like that. And I do also want to say that it has a time limit. This one on here, it's saying 24/7. We're here for you 24/7. But I thought before that it was up until like 8 p.m. or something like that. And so when you go to this resource section that says Trevor Support Center, it has different categories, which is cool for this one. So unlike what I was explaining with 7 Cups or BetterHelp, so 7 Cups is peer support. So you can either sign up to be a support person, a peer. So if you know a lot and you're not having a lot of like issues on your own that you're trying to resolve, and instead you're trying to help other people, you can sign up to be a helper on there. You can sign up to help people, and be, have a profile where people are asking for your or getting support from you. Or if you need help, you can create a login and, ask for help from people. And I think going both ways on that can be a very helpful thing. Sometimes trying to help other people can kind of help you realize different things. I wouldn't say try to help other people if you haven't worked through something on your own, or try to help other people if you haven't dealt with a situation and you don't really know maybe what you're doing. Don't test it out on some other person. But I would say it can help you kind of delve more into things that you're trying to grow in. So say for example, a person who no longer has gender dysphoria, but they're like, oh, these situations come up I don't know, at a church or something like that. There's a stressful setting that the person is still involved in or something, and they want, maybe they can kind of look more like that. It would force a person to look more get into the support area, and find answers for other people. And then in turn, they can figure out if that is something that they could apply or not, in their own lives. I mean, we all are learning. So anyone who's still, doing counseling or help or support work, anyone who's doing those kind of things, I think, there's always this joke out there, and I think it's a stupid joke, but it's a joke that people say, and I think they say it out of getting kind of uncomfortable with the fact that, people who work in counseling and therapy kind of have not a control or a power role, but it's kind of I think people think in that way that this person has access to my mind in ways that, they could kind of abuse that. And I hope that never happens to people. But unfortunately, I do know that there are some jerks out there that do that. And I think you should report all of them all the time. Just report these people to Adult Protective Services. If they're predatory types of people, just get them out of helping people, because they're not doing anybody any service, and they're making people worse, and feel worse, and that's terrible. They shouldn't be in the field. They should, I feel like they should have some kind of, they should be reprimanded. I think they should have to pay a penalty or get charged or have some kind of fraudulent, I think even if it's just a little bit, I think people really rely on that kind of support. So I think when there's someone taking advantage of that, I think that, they shouldn't just be able to get away with it. And I think that it should be taken very, very, very seriously. So I don't advocate for, people who are going to be jerks to their clients and their patients, but I know that definitely exists. But so I would say, all that being said, there's a there's this guy out here racing a car. always over here. Um, there's a certain type of, I'd say, support person that you might want to actually get like in contact with, that you might want to actually like try. And so the 7 Cups support and the Trevor Line and the BetterHelp support, those are good resources. And there are more, but yeah, what I was gonna say is there's always that joke about therapists. I hate the word crazy anyways, but that's kind of part of the joke. They say therapists are usually crazier than their own patients. It's kind of like, come on, man. Like, that's really not a cool thing to say. And there's a lot of stigma around mental health in general. And so, I would say in general, there's already so much stigma for people to try to get help. It's like that kind of comment deters people from wanting to get help, because like, who's going to want to go get help from someone who's an asshole or a jerk, or who's not even like helpful and making somebody feel worse? And if someone goes into a setting thinking, oh, this person doesn't know what they're talking about and they don't really know anything, I mean, it sounds, that's what it can sound like. But so that's why I'm trying to differentiate between, peer support, which is, anyone who kind of passed the questionnaires and kind of feels like they can kind of help out a person. Like, there might be a little training process to become that peer support person on these apps, and then you can become that, but it doesn't mean that that person's a licensed clinician. Is it helpful? Yes. It's a different kind of help, though, and it's not any less helpful, less valid. It's different when somebody's gone to school for so many years and learned evidence-based practices that, they're called evidence-based because they've gone through research processes that proves that, it helps a certain amount of people if it's done in this specific way. If it follows this certain kind of method, there are a lot of people who it helped people enough. It helped enough people that it's considered evidence that is actually supportive and helpful. So, that's what, in a nutshell, what evidence-based practice is. It goes through a rigorous research project of like years of, examining kind of the processes that are used and the results that come out from it, and like scores and different exams and assessments, seeing how the people changed from when they came into that treatment versus when they ended the treatment, when it was over, if they completed it successfully. And then it shows kind of how the results look, and if the people are still exactly in the same shape they were, or if they've noticed improvements to a significant amount where it's considered, hey, this worked. So evidence-based practices are very important, and they're kind of difficult to learn without supervision or without support or without, training. It really takes a lot to understand those, and a lot of peer support people might not necessarily use a lot of them. A lot of them might use like MI, motivational interviewing, some other types of milieu types of therapy, kind of like rapport building. And there's a different like connection level, I'd say, with peers. So peers a lot of times can be a lot more personal. They can not like, okay, a patient comes in and then they just start like unloading on them about all their issues. But sometimes it's like, a client or a patient or someone who wants assistance goes into asking for help, and a peer support person kind of doesn't have those same rigid expectations as a therapist would. So for example, in places where I've worked, the therapist would be in the office, the clients would come into the therapist, but the peer support person was allowed to kind of go, pick up the same. I would have clients that I would share with a peer support person. That person was able to kind of go to the house and pick them up, take them on walks, maybe around the block, take the person to a Starbucks, and then they'd have a chat there. And that was kind of the main method of kind of being able to get the help that they needed. But the therapist's relationship is different than the peers relationship with the clients. And so when it comes to online peers, sometimes they don't really go through even an evidence-based peer, what do you call it, like a peer training. A lot of times, they can be just a peer, they can literally just be like a person who feels like they want to help and they're motivated to help and they want to just be there for people online, and then they sign up and they do that and they're good at it. It just because a person doesn't have a degree doesn't mean that they don't know how to help somebody. Just because a person does have a degree doesn't mean that they're crazy and that's why they have it. So these kind of things, I think that, it's good to kind of break down those kind of thoughts. And I know that people joke, and I can take a joke. I'm not that serious, but when it comes to certain things, there are some things that, just for me, just because I work in a certain field where I've seen and heard people, and I know how hard it is for people to go in and get help that they need, and then they come in and they're in a very vulnerable state, and then it's like they have people that, like, I've literally had clients come in and they're like, oh, this is my mom, or this is my dad, or like their parent or whatever, and they're like, I'm doing an assessment trying to get like a feel for what kind of symptoms they have, so we can come up with like clearer information for the diagnosis, and this information goes in when they see the psychiatrist after they would see me. And I'm sitting here like assessing this person, talking about different symptoms of depression, different symptoms of trauma, and then you have the parent over here snickering and laughing about like, oh yeah, they're talking to themselves all the time, or like all these kind of things. It's just like, wow, like seriously, like and then they wonder why you ask them to leave. So it's like stuff like that that's kind of like it's hard to see and it's hard to witness, but it happens. And I'm not talking about like 20 years ago, I'm talking about like weeks ago. So it's not something that is uncommon. And so I think it makes it harder too when people have like, when they're trying to put up supportive information, and then on the other end people have their families or other people in their lives that are kind of trying to hold them back from the support that they need. And honestly, if someone's ever trying to hold you back from getting help, I mean, what's their motive, really? That's not a helpful thing. It really isn't. So if you feel like you need help, and if you want something that's kind of maybe more discreet, and you don't want something going on your, insurance, or having people, like, say if you, some different scenarios come up, places mail you, and, we've had sites where we're like, okay, the letterhead on this, somebody can Google the letterhead and find out that this person's getting therapy. Or they can Google, you can Google anything. So it's like, if you're signing up for services with certain places, you might get physical, like, snail mail, like, in your mailbox. And then somebody, if you share a house with somebody, you might not be the one picking up the mail. You might get, they can be like that for like appointment reminders. Some places send them by mail. Or if you're sharing a phone with somebody, I mean, they're not supposed to leave like, of course all the messages should be discreet, but if I call somebody and I say, hi, this is Grace from so-and-so, leaving a message for this other person, I might not even say the whole exact name of the place, but it's like, people might be able to figure that out. And sometimes people don't want that. So that's where the online support sometimes comes in handy too, for people who want to test out something, for people who've never really been comfortable going into therapy, or who just want a little help right now, and they don't want to go through a whole, like, if you wanted help right now and you were not in a crisis to start therapy, and it's Sunday night when I'm recording this, but say if it's Sunday night and you sign up online Monday morning, you're very likely not going to see somebody Monday. You're very likely not going to see somebody Tuesday. And so, online support's very helpful, because you can talk to somebody more immediately about what you're going through. And hopefully these sites are getting more packed and crowded, but usually it should be within the same day that they're contacting you back. So the cool thing about the text support is, and there's another one, so 678 text start to 678. There's a 24-hour crisis support line that's not always only for crises, 110%, but they can also help too. It's 741 and there are 2 words you can text, but only text one of them at a time. Either the word home or the word courage. So text home to 741 or text courage to 741. And it starts to queue for you to get a support person to talk to you. They'll call you when they're next available. And so they kind of triage, they kind of put you in a category kind of level based on what you say and how immediately you need the support. So the Trevor support line as well as that crisis support line, they will both put you in line according to what you say. So if you're at risk of self-harm, if you're at any kind of risk, I would say, definitely call 911, get yourself into a hospital, go to the ER, get yourself help immediately. You don't want to be relying on these types of, not that these apps aren't helpful or that they're not supportive, but I think 911 would be a better route to take. The ER is a better route to take, just because, they're going to have to see you, but also consider what your insurance is, consider if those places are going to have a bed available for you. If it's like a crisis center or someplace, sometimes they're not available right away. If you've never had treatment or support before, oftentimes they might, get you in because you've never had that support before. But sometimes when you have had that support often, they'll be like, oh, you come in here like every couple months. And so sometimes, they kind of might not prioritize those people. And it's unfortunate. And that's one of my least favorite parts of work, is having to go back and forth with like a PERT clinician or like a police officer and explaining why your suicidal client needs to be in the hospital, and they're just like, no, they can just go home. And you're just like, no, like take them, and they want to go, and they wait all that time hoping that they're going to get into a hospital, and then the person who's supposed to take them in is like, no, like they don't really meet enough criteria enough at this point. Even though literally, it's like, it's pretty heartbreaking to just see that, but that happens too. And, I don't want to try and like scare people away from getting services, but that's the reality of it. And especially with things being so, people having so many, hardships going on right now, things are getting more severe for more people. Probably more than what we've ever seen before. And so there is more need for these services, but there are less services available. And so I'm glad to see that some of the online support is stepping up more and more. Like this Trevor line is now 24 hours, which it wasn't before. And yeah, the Trevor Support Center is cool. It has asexual, bisexual, coming out, family and friends, gay and lesbian, glossary, healthy relationships, HIV, AIDS, homelessness, I have a crush, in school, international, LGBTQ plus, LGBTQ and religion. I think that's what that plus was, plus religion. Mental health, self-injury, sexual health, and trans and gender identity. So it has all these different cool topics that you can go on here. You can check out the site. And it says you are not alone. And so, it's a great resource, and it's free, unless your phone charges you some kind of text service, or your internet, charging, or your data charging you, or something along those lines, or your phone charging if you call. But I really think this one's cool because it's basically just, categorized. And so that's really cool. So if you look in the resources, it tells you information about like definitions, different types of subcategories of people's identities, frequently asked questions. Here's a question. Let me just read one of these questions in the asexual section. Question 3, it says, I kissed my boyfriend for the first time and it was gross. Does this mean I am asexual? Or there's another, let's go to another category of questions. So trans and gender identity, you can scroll around on that one. Some of these questions are a little bit more lengthy. Let's see. So question 3, lately I've had this desire to be a girl. I know I'm not ready for a sex change, but I'm planning to grow out my hair and wear more girly type of clothes. I'm not sure what my parents would make of it, but I can't get this off of my mind. Should I go ahead with it? And then it has an answer. The beginning says, if you feel safe and comfortable starting to express your gender in a new way, then that's your decision. After all, you know you best. Further down it says some other questions that they might want to ask, such as, are there LGBTQ affirming student groups who can offer you support? Do you think you would put yourself in danger if you started expressing your gender differently? This is still part of that same question. And so, and then it still has more resources. So this, you don't even have to talk to anybody on some of these apps. 7 Cups, you don't even have to talk to somebody. It's just support as an option. The Trevor line, you don't even have to talk to anybody. They just have this option on here. That you can, but you don't have to. So some people who might be a little too shy to kind of speak to someone, or even like texting someone, because some people don't like texting, they could get the support that they need in those ways. And so I think that's a helpful thing to mention, that there are these free support sites. They're not going to charge your insurance. They're not going to show up. I don't know how phone bills work because I haven't seen one in absolute ages, and I don't really make phone calls on my phone, and I'm on my family's plan, so I never really see the bill. But I don't remember if they still have the calls listed like they used to. So there might not be privacy there if you're using the phone to call. But if you have Wi-Fi and you can go on the app, or if you're able to text, and that's not going to charge you, then that's pretty discreet, and you can delete those messages if you need to, or copy and paste it if you wanted to like an email or something, so that you kind of have it all saved in there. But yeah, I think it's really a really helpful thing to kind of know the resources around you, just so that like what you can use, what you can do, where you can go, who you can talk to, in case you need to. And you might not need to, and you might need to. You might be in a position where you probably should talk to somebody, or you might not need to at all, and it's just like an optional thing. But it's good to know yourself. It's good to be brave and not be afraid. If you do come across someone who's a jerk and taking advantage of their power and their role and their like expertise and making you feel like crap, find a way to report that person. But I would really say, I really recommend for people, if they are having issues with gender dysphoria or some sort of issues with, their gender identity, or any kind of stressors coming up, and it's something that you're ready to start working on, It's good to take advantage of these free supports because they're there for you, and it's helpful, and it's temporary too. You don't even really have to, if you're not paying for the therapist, you're probably not very likely going to talk to the same person all the time. Now, Seven Cups app, it kind of saves your conversations a little bit. So those people, if you have like an understanding that you can come back and check back in, that's an option. But also, you don't want to get like attached, and you don't want to get like, you're not pen pals, you're not buddies, you're not supposed to be meeting people, you're not supposed to be dating these people, you're not supposed to be, like having, lines can get blurred and confused a lot with different sorts of support services, and especially when it's like somebody's talking about all these intimate details of their life that they've never talked about with anybody else, and then all of a sudden they're like, they feel this connection, and it's almost really better to just like not really have that connection. Treat it like a professional relationship, so you can get the work done on yourself. That's the whole purpose, is to get your own work done. It's not to connect with somebody and form like long-term, lifetime, permanent like family relationships with the support person. That's not the purpose, because it gets in the way of getting help. If this person, like, if they start hitting on you or something, like, I'd say by all means, gosh, like, that's not appropriate. They shouldn't be asking you for, hey, let's meet up for coffee. I mean, nobody's probably meeting nowadays anyways, and I don't know of any coffee shops even open where I live where you can sit down. But just in general, just general rules of thumb, you treat it like a professional relationship. It's almost like an interview every time you go in. You wouldn't like go into an interview and start like asking somebody out on a date. It's kind of like, you can acknowledge that the person's attractive, or maybe that you like their style that they communicate with you, but you don't have to fall in love with them and things, or even want them to be more a part of your life than they are legally or professionally able or allowed to or supposed to be doing. You don't want to get in that kind of a situation. So keep it professional, get the help that you need, but keep it professional. That's really what I would recommend. Know your own privacy, your own kind of rights, like no counselor or provider should be holding things over you and saying like, oh, like, if you don't tell me your actual address, I'm not going to help you, or like things like that. Like, they shouldn't be holding things over you or pressuring you. Like, if you're like, hey, I really just don't want to talk about that, and they shouldn't be like, hey, like guilting you into like talking about things that you're not really willing to speak about. It is a consensual type of a service. Someone's not like forcing you into this. There is such a thing as involuntary, like an involuntary hold in a hospital, or involuntarily being admitted to crisis treatment, but that's not what this necessarily is, unless the things that you're saying alert the person enough that they need to call somebody to come and take you into a hospital. You're likely not going to be going into the hospitals. I'm just assuming that, if someone's not in an immediate crisis, and by all means, if you are, call 911, go to the ER, get yourself into the hospital for those reasons. Get there faster than, texting online and things, because, based on the process, you might be one of 30 in line. It might take an hour or 2 hours for them to talk to you. It might take 20 minutes. And so, it might take 5 minutes, but usually they spend a little bit of time with you. They're not going to spend all day and all night. They have other people that they have to speak with also. So, like on these text lines, on the Trevor line and the crisis line, those are the two that, they have some time limitations. It seems like they take about 10 or so minutes with people. And so that's why Seven Cups is kind of cool. Even though it's peer support, unless you pay for the therapy, even though it's peer support, Those people are usually logging in when they have the time to do it. And they're just there to be open, for you to like be there for you. So, I mean, I think, that is probably a nice short list of ways that people can get support. And there are a lot of resources that even if you're not young, if you're older, a lot of these still cross over. The Trevor line, even if you're not an adolescent, even if you're not a very young adult, you might still have this, what is it? You might still have what do you call it? Like, yeah, if you're not a young adult, they might still help you. They try not to turn people away, but I would still recommend checking out all these sites, just to browse around, see what they're like, see what you think might work for you. Watch a couple YouTube reviews of them. But, definitely know your rights going in. A lot of people, like, online type of therapy and treatment is new for a lot of people, and a lot of people haven't even started doing it up until 2021 and 2020. They didn't even know how to do these types of things. It never came up. It wasn't an option, even though, I mean, we were capable of doing these things for a long time, because we do them in other areas of our life, but never so much as now. I would say for most people, I think most people would agree that we're spending way more time online now to get our needs met, than we were before, the last, 11 months, 10 months or so. And so, yeah, it's just good to know your rights. It's good to know, what is okay and what's not okay. And I like to put that out there because sometimes people feel pressured. It's like, if a doctor's telling you something, or if you look at someone and almost view them as if they're a doctor, and it's like, in some cultures or in some backgrounds, if someone's talking to a therapist or a treatment provider, they feel like, oh, this person's like a doctor, like I have to do what they say and listen to everything they say. And it's like, you might not know the difference between like a peer support person or like a licensed clinician or a psychiatrist. These things are different. And none of them should be like making you feel bad ever. That's not how therapy works. It's not like television with somebody like screaming in your face and all kinds of nonsense. All those kinds of things. Like, I don't know what else would be helpful to really mention, but I think that those are some easy ways that people can get help within, usually within 24 hours. Now, mind you, depending what the issue is when you're going into some of these free services, if they don't think that it's something that they need to prioritize, they might not. They do have high traffic hours. So if you feel like, it's kind of a more mild issue, you might want to try them at a time when, there might not be as many people online, like 10 o'clock on a Monday or something like that, versus like, Friday night at like 6:30. Like, there are times when more people are going to be home and having more free time versus other times when people aren't really going to be online. But now a lot of people are online and a lot of people are at home anyways. So that's the thing why I'm saying that it's harder to predict, like, how long are they going to take. They're getting really good though with these services. And so even though there is a limitation out there with support services, a lot of these online services, I'm seeing changes like right in front of our eyes, like within months and weeks, of places that are like changing their support options to offer more easy support so that people who have internet access can go on and just get the support they need as quickly as possible. And in a lot of ways, some of this is a lot more helpful because people have more control over doing what they want to do because they're not bound or limited by, transportation issues, or for even like, for example, this online 24-hour support. They're not, you're not bound by time. Like, if it's Sunday and it's like 6:30 p.m., you're not likely going to be able to call your therapist, even if you have one, right? And so, you have these other options at your disposal that you can use, and you can test them out. You can watch reviews about people who have used them and what they like, what they dislike. I'm just telling you kind of my perspective on them. And I am going to record a scenario about ISTDP. I'm just going to have to write out that scenario. I'm going to do like a case study type, and we'll look at one. I'll see maybe if I can find a case study that I can kind of go through how ISTDP by John Frederickson is used for people to kind of get help, but also how someone could use those methods in a self-help kind of manner so that they can use it and actually get the help that they need, by internally just kind of like understanding it. I'm not sure how interesting these types of topics are for people. I used to have a YouTube channel called Binaural Tracks, BIN AURAL, and then Tracks, TRACKS. I think I had some couple of mental health related support videos on there. A lot of things that I noticed that people tend to not take care of, and I'd say, well, not a lot of things, but a couple things that I think are some of very valuable things that people maybe overlook or don't often take care of, that you can learn how to develop comfort with it, is emotional processing. That's definitely one that a lot of times people don't want to get into that. They're not comfortable with emotions. They're taught not to like emotions and to only accept being happy or angry, but you can't be depressed or anxious, or like there's certain emotions that are people feel like they're more appropriate. And a lot of times we do tend to base what's right or wrong based on how we feel. And that's something that is a lot of times, sometimes you'll feel a certain way because of how you were raised or how you were taught. And so when you think about that, it's like, okay, if I feel uncomfortable, I feel like this is wrong because I'm uncomfortable. But say, like, if you're experiencing depression, that's not really wrong for you. You're not a bad person. There's nothing wrong with feeling depressed. But people might think, oh, this is so bad that I'm depressed. And so things like that, because they're taught, don't cry, don't be sad, tears are for babies and all this kind of nonsense. That's like, nah, babies cry, adults cry, everybody cries. It's more normal to cry than it is to not cry. I think it's concerning when people are like, I never cry, and it's like, oh wow, that's not good. It's not good to never cry. It's accepted in society when people say stuff like that, but it's not healthy. It's almost like if somebody said, I never poop. It's like, cool, but that's not healthy. Your body and your mind and your psyche, and it purges itself of toxic things. And so if you think of things that are trying to just come out of you, it's trying to get things out of you sometimes that don't need to be there. So if you're holding them in and, it's basically, festering on the inside and not helping you, those things need to get out. And the way I think of it, I like to think of it like, if you haven't had a bowel movement in a day or so and you're kind of backed up or something, that needs to come out, like it can't stay in there for like weeks, or days, it's like some things need to get out immediately, for a person to like feel better, or, in a safe way, obviously. But, yeah, like people are just taught all kinds of things that really stick, and society backs it up too. And we're seeing more and more that there is a change, but when it comes to mental health, a lot of times people don't even know how to address their mental health. The first psychology class I took in high school taught about like, B.F. Skinner and Freud and like terminology and a lot of names and stuff, but all the classes I took, I think we weren't doing any real hands-on work. And I came from that was worded incorrectly. So I came from a research background, and up until grad school, I mean, we had research projects all the time. And up until grad school, we started, we had like bigger research projects, but because I was in research, we never did anything clinical other than learn about like some clinical terminology, some clinicians, some evidence-based practices, how they came up with their types of surveys and different things like that, and how their therapy is used. But we didn't actually ever really learn to do therapy until I was in a clinical program. It was a research and clinical program. And then we started learning the clinical side of things for that program. And so, I'm just mentioning that because a lot of times it's not really going to be like hands-on stuff that people are doing sometimes in this field. So yeah, I think that's just about all I really need to mention about this. I would say a lot of it's going to be on individual people to kind of go in, see what it is they want to work on, try to narrow it down for yourself. Podcasts and videos can be very, very helpful and beneficial and resourceful and maybe more interesting and fun and easier to understand and less cumbersome to try to like read through. But if you're comfortable with reading and stuff too, there's nothing wrong with that. But I would just recommend, take advantage of any free resources that you have. We've seen this, guys, where things go from free and fun to now all of a sudden you have to pay for it. So these things are free now. They're discreet. They should be discreet. People aren't supposed to be like trying to like date you and like look up your information and all kinds of weird stuff and what's your Instagram and all, like they don't need to know that. They're supposed to be helping you with whatever issue you come to them with. They're not supposed to be trying to like get followers on their social media and whatnot. But if they do say that they do that and they do have like a support site or something, just don't give your information to people that you don't know. These people, online is different. And I know like people are used to using like dating apps and different apps where it's more social and you're like, hey, yeah, like I'll chat with you in a private chat room or something. And, that's fine for those apps. But for these apps, they're professional. It's supposed to be kept professional. So on your end, keep it professional. On their end, they should be keeping it professional, guys. They shouldn't be like making you feel uncomfortable and all sorts of things. They shouldn't be doing anything that's like against your will. They shouldn't be making you feel worse. The good thing about an app is you can technically just delete things. So if you come across somebody who you really just don't want to talk to, you have options of just exiting out of that immediately or reporting the people. When people are doing wrong things like that, they know that they are. And there are people out there. And I'm telling you, I test these types of apps and I've come across like a couple interesting kind of pervy types that it's kind of like disturbing. But I would say the majority, from what I know, and from what even other friends in the field have told me, these resources seem to be, very helpful and supportive for people overall. It's not going to be 110% because people dealing with other people, there's always going to be room for error and mistakes and misunderstandings and like different things like that. But it can be very supportive and helpful too. So, don't hesitate to reach out for support. Don't hesitate to dabble in it. If you're not even fully ready, go on that Trevor Project website, check out, some of the categories on there, see if it's on point for you. I mean, you may not be LGBT, but you might still, have different topics or interests, that could be in these categories. And, it's just helpful to kind of talk about with somebody. So, even the questions, that are kind of like the questions and answers, that are frequently asked and things, it's like, those are still even helpful just to kind of process for your own self. It's like, wow, what would I say? If this is really an issue I'm going through, like, how do I deal with this? How do I manage it? And then, what do they recommend? What do they say? Really trying to break things down. But I'm kind of gonna go into more therapy mode in some of these other recordings that I do. They're gonna be more about like kind of more thought provoking, but I'm trying to like get some kind of background to it as well, some kind of foundation to it as well, so I'm not just like talking and it just sounds like like what's that cartoon, Charlie Brown, how like the parents when they talk they're like wah 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 wah. And it's like I don't want to sound like that. I want it to make sense, because I think if anyone's listening to these, and if they find it important, I want to at least provide something helpful and supportive for people who are putting in the time and effort to like listen to these things. I don't want to make it like not make any sense or be like complete gibberish when I'm completely capable of making it helpful and make sense. And so I want to make sure that I take my time on it for you guys. So you can expect that coming up soon. I'll test a couple of those out and see if people are interested in that kind of content as well. And then hopefully it'll be helpful and fun for people to feel like they're not like in a hopeless situation, and to feel like they have some support and something maybe interesting. I'm a total geek about science and research and statistics and evidence-based practices and clinical things, and so I know that I can get pretty overboard on that. So I would hope that people would just tell me by being like, hey, tone it down. But I really do love making these episodes. I find them really fun to make, even though sometimes the topics are a little heavy. I find it pretty fun to make the audio recordings, and I appreciate anyone who's listening to these. Trying to keep it real, keep it authentic, help other people to be their most authentic version of themselves that they feel like they can get to, with all the things that you have to deal with just to be authentic. Isn't it weird how hard it is to be authentic? It's harder to be authentic than it is to like fake it through life, which is so sad. But I mean, I feel like sometimes a lot of us are stuck in an environment where we're kind of like, I have to fake who I am just so I can get by, versus I just want to be myself and not have to think about how to not be myself in certain settings, and this person with that person, and what's going to happen here and there. It can get very stressful. So yeah, I know the stress is out there. It comes up for me too. I'm one of those people who's like a lot more likely to try to work on something all the time. But I have bad days. There are days when I'm just like, I can't go to work. It's just not gonna happen today. Or like, I didn't sleep for like a couple days or whatever. Like, like I have days like that, or a couple days like that, but I try to get to work on it quickly. I find that the most helpful thing is, when I notice something's coming up, work on it fast, get what I need for myself fast, and not wait on it, and not put it on hold and ignore it and prioritize other things. Like, nothing's more important really. There are things that are more important, but your health is a very, very super important thing. You need to have good health. You need to have good mental health. You need to not have constant continual stress, and especially if you have at your disposal some supportive resources, hopefully that can just make it better for you, so that you feel comfortable and more equipped to deal with the problems that come up, versus feeling like, oh, this is coming up again and then there's nothing that I can do to deal with it. So I would recommend try some of these things out, see what you think. I hope it's all going to be helpful, guys, and I gotta go eat dinner. So thanks for listening.